The next person I have for you is more than just a person. She's actually an icon in her field. Leah Taylor, MD, ex-cardiovascular surgeon, at the age of 55 wanted to create a more preventive model. She's been in the depths of surgery. She knows what a sick heart looks like. She also knows, much to my surprise, what a sick mouth looks like. Leah is at Millennium Medical. That's an interesting skill set that she's building up here. It really communicates to me how our formula is so critical for the whole physical health. And her aspect would be, of course, both nutrition, structure, and toxicity. She hits all three with that. So with Leah, when you see her interview, you'll see that she knows what she's talking about. She's very enjoyable with her narrative. Here she is.
It's not a coincidence that in my life and in my heart surgery and thoracic surgery, I frequently was called to the head of the table by the anesthesiologist to say, look at this mouth. You cannot believe the amount of oral and dental disease present in patients undergoing heart or lung surgery, particular cancer surgery. It was sort of an undercurrent in my training, at any rate, to notice the mouth particularly as part of at least something that was associated with end-stage disease, which is what I deal with in heart surgery for the most part as an adult heart surgeon and adult thoracic surgeon. I'm dealing with cancer. I'm dealing with people with blockages of their arteries. I'm dealing with valves that have either gone leaky or blocked up or become infected. How does that happen? Well, we know for sure that it happens when there is infection elsewhere in the body. But short of that, short of having bacteria grow on a heart valve and have the heart valve need to be removed, there's got to be some other level of interim disease that's happening. So I think that's my transition from understanding how to treat the end stage of a problem and how to understand how to save lives that way, to wanting to go a little further back. And I think that I'm not too unusual, although you seem to think I am. I think a lot of heart surgeons and heart specialists are starting to understand that we're chasing our tail at the end of life when we should be trying to understand and prevent disease progression. I believe that we're successful with our patients because at Millennium we work as a team, and I have been honored to work with many healthcare providers with knowledge bases outside of my own, thank goodness. We do work as a team wherein Western medicine is very structured and very hierarchical. And of course, I'm still the boss here, but everyone here has something to offer the patients. I have my Western background and my knowledge of how to treat disease. I have other health practitioners here that understand how to treat the body, the muscular system, the skeletal system, how to instruct the patient in nutritional information. And then I have the ability also to honor that all of our patients, almost all of our patients now, have to pay healthcare premiums and have healthcare insurance. And we are able to provide care based on what their healthcare insurance will pay for, where they might not get elsewhere, if you know what I mean. In a place that offers alternative care, frequently they're not on an insurance basis, and everyone here in this country is now getting insurance, and we need to honor that. And because I am an MD, I can do a certain extent of their care that way and honor their need to pay premiums. But another ingredient, I think, to our success is because of this model, we're able to take a little time with our patients. I think patients here know that they get seen and heard. We're not constantly in a rush seeing our patients, because that's not what our business success is based on. We're not seeing an excess number of patients every day to where we have to run through the patient interview very quickly. We give everyone a chance to express themselves, and we try very hard to answer all the questions before the patient leaves the office for the day. I think those are the ingredients to our success in helping educate patients and helping treat problems when they do come up. And we have the option of offering Western, middle of the road, or a combination of both, or strictly alternative treatment. I think everyone deserves to have a choice in how they want to proceed with their lives and what they come into this world with and how they leave this world. Western medicine, and I know we're going to talk about this, Western medicine is very, very, very good at end-stage treatment, and I think we've touched on that. We are very good in Western medicine in knowing when something is very serious, in the moment or in the very near future. And I think we all in this country are lucky to live in this country and have the benefit of that. For instance, if your aorta is splitting or dissecting, or if you have fallen down and now you have a compound fracture with bone sticking out, or if you're trying to deliver a baby and you cannot deliver the baby, put me in the United States of America, because that's where I want to be, and that's the kind of care I'll need. Short of that, though, Western medicine has fallen in terms of being able to help the vast majority of people who are the living but not necessarily the well living. Patients do deserve an alternative. We deserve the information in a way we can digest and incorporate into our lives. We have not been able to get that. Not much has been known in terms of preventative methods here in our country, because so much of our focus has been on development of technology and development of skill. Patients deserve to have the choice to go all directions with their health care. We deserve the ability to get the information that will keep us off the operating table. We deserve to get that kind of information in a way we can understand. We deserve to have that presented to us as often and as frequently as the way to live unhealthily is presented to us, such as every ad on TV, such as every fast food store or fast food market you might find. So yes, we deserve that alternative. I don't know how we're going to get that alternative presented to our country at this time, but I agree with you, we deserve that. No, I think that's a great teaching formula for patients to understand how to achieve health. I do think that it's very important to educate patients on how to get good nutrition. It's not as easy as simply just shopping at the organic market. There are a lot of minerals, etc., missing now in our diets, even when we try to be as clean as possible. I think patients need to be educated on what constitutes a toxin, like everything we take for granted in our culture, and in the convenience of our culture has a toxic quality to it. So I think that's very good for educating patients. I think what if we want to be complete in that education, though, I think we take the physical, the structural, the muscles, the skeleton. We take the internal milieu, meaning the nutrition and the state of the oral to the anus part of the gastrointestinal system, the state of the lungs and heart into consideration. But then I think we also cannot leave out the importance of the mental, spiritual, and emotional component of health. And I don't profess to have any skill in that area at all, but I've seen the power of it, and I think that to present just things that are within my particular range of knowledge, it leaves the patient short somewhat. So I think it's also important to let patients find emotional and spiritual wellness as well as physical wellness. We haven't scratched the surface of what there is to know, but I don't know if it's important to know everything. What's left to discover? Well, I think the biggest thing next to discover is the time machine. Honestly, because we need to go back in time and start over. with this whole process. The next big discovery, there may be stem cell discoveries, there may be new uses of laser, there's certainly going to be more knowledge about how our brain works and maybe the understanding of what separates our brain from our mind. But in terms of how much that will benefit the population at large, I have a lot of doubt. I think that what we need to do, and what the next discovery and the next movement will need to be, is to learn how to not need that knowledge to begin with. Learn to be a population that doesn't need stem cells to live longer. Learn to be a population that doesn't have to have a heart transplant to live longer. So I think the next big discovery is for us to go back in time, start over, start learning, start understanding and respecting that though we have achieved a certain amount of knowledge and a certain amount of technical skill and an amazing amount of molecular biology knowledge, that's all very wonderful and well and good and truly amazing, but we need to learn how not to need that. And understand that simply because we can do a procedure or can create a drug doesn't mean we should let ourselves get to the point that we need that.